you joining us tonight. As I hope you can see on your screens, we have with us the president of our board, Serge Offers, CFO of ING, and one of our guest speakers already joined us. That's Mr. Paul Iordache, Dr. Paul Iordache. He's an epidemiologist. Later on, we'll be joined by State Secretary Andrei Baciu from the Romanian Ministry of Health. And as you already know, the topic tonight is COVID-19, the vaccination process. Before I leave the floor to our president for the official introduction, let me just go quickly over the rules. I see that already everybody is on mute, and I would kindly ask you to remain as such whenever you are not intervening in the conversation. This way we can avoid any unpleasant ear-splitting feedback. We received many questions from you, and we hope we can approach them all. If during the presentation you think of other questions you'd like to address our guests, kindly use the chat. Just type in your question there, and we'll try to get to all of them in the Q&A part of this webinar. Now, without further ado, I would like to wish you all a really good webinar, and I leave the floor to Serge Offers.
Thank you, Veronica. Yeah, let me also start by thanking Dr. Paul Iordache, and I really hope I pronounce his name properly, but I have not practiced the right pronunciation. And State Secretary Baciu for being present today and to provide an update to the members of the Chamber about the vaccination program, and also to take the time to address what I've seen, many questions that are on people's minds. And after the short presentation of Dr. Paul Iordache with State Secretary Baciu, there will also be time to answer all the questions, and Veronica will kindly moderate that. I think after a year,
thank you very much for the invitation.
You're most welcome.
Sorry to interrupt.
No problem at all. I think it should be about you, so I will be very brief, don't worry. But I think after a year of very much uncertainty, many of us are looking forward to see also the country opening and some of the economic recovery to materialize. But we all know this is also pending and conditional upon the success of the vaccination programs. And we're very happy to see that Romania ranks high among the European countries in rolling out the vaccinations. And I have actually been vaccinated last week myself with AstraZeneca in Romania at a time that is similar to my father of almost 80 years old in the Netherlands. So I think from a progress and a speed that has been done, I think Romania is really on a good track. For me, I think, and that's also what I would really appreciate to hear is, on the one side, what are the things that you think we should know? But also, please do not hesitate to let us know as a chamber, and we represent a lot of employees and also a lot of companies. Where can we help the ministry with, for instance, sharing the right information, creating awareness, or maybe helping and supporting in some of the campaigns? We are here and we are ready also to collaborate on that front. So on the one side, it is information sharing from your side, but be aware that we are here to help fight the pandemic and to see where we can help you and also the others of the government to make sure this is as successful as possible. With that, I will stop talking and hand over to you. Thank you very much.
Thank you very much for the kind words. And in the beginning, just to highlight the importance of the private sector in general regarding the dissemination of the information regarding vaccination. I think this topic is one of the most crucial aspects of the success of the vaccination campaign in Romania. The fact that everybody got involved, from the medical staff until to the everybody, like the general population, was involved in disseminating information and pushing this message of keeping the vaccination process active and enrolling people as a continuous flux of individuals were going towards vaccination. I think this is the key element of the success of the vaccination. So before we start, we want to apologize on Mr. Andrei Baciu. It's caught up in a discussion and he will join us shortly. And just to say a couple of words about myself, my name is Paul Iordache. I'm an epidemiologist. I'm a scientific advisor in the Senecav, the the Committee of Vaccination. I'm also an assistant professor in University of Bucharest, UMFCD Bucharest. And because I have this scientific background, I think for having the best personalized experience in this webinar, I think the best point is to just go into the questions, if it's okay with you guys, and just address as many of the questions as we can, because I think it's all the information right now are known regarding like presentation of the vaccination. So I think we want to have like a really personalized experience for you guys. So if it's okay with you, let's just move into the questions.
Sure. So I will just go through the questions that we received from our members. The first one is, what is the average age of the people that got to IC, to intensive care, with COVID-19?
Okay, so this is a really good question and a really good starting point for the discussion. I was actually reading a couple of days ago a report on the French medical system, and there's two major age categories that are the most frequently involved in IC care. We're talking about the 60 to 78 years percentage that goes into like about 31%, and the second one, which has like a similar value, it's from 70 to 80. So if we look at this, more than half of the people that are going to IC are in these two age groups. And one of the things that I think it's most important right now to discuss also is we're looking at new variants of COVID virus. We are talking about the UK variant, the African variant. So it's actually changing this dynamic a little bit. We are seeing a shift from this late onset of the disease to a little bit of younger population that's getting COVID-19. And I think this is a situation that needs to be addressed and followed up also by the scientific community and also by the health sector in general. So this is, I think this is the information that we have, but it's an evolving situation. Next question.
Yeah, does the nowadays matrix to build the intensive care capacity in Romania and European Union takes into account the increased life expectancy of the individuals?
Okay, so this kind of follows up the first question. Right now, I think I want to like look at the bigger picture. Right now, I don't want to use the word crisis, but we are in a healthcare crisis. So everybody in the health system, it's my colleagues, other medics, are pushed to the limit. So we right now, as in a war, right? You're trying to first win the war, and after that, you can think about how can we heal the wounds that are caused by that war. So the matrix for building, I see capacity. It's a really complex process when it comes to Romania, and also when we're talking about integrating this process in a European vision. So of course the whole medical system, it's adapting for the last 50 years to this increase of expectancy of life. But right now, to just answer the question, yes, we're looking toward that. But I think the most important question right now is, as a practitioner, I have colleagues that are facing this pandemic on the front line. I think it's the most important is to just address IC capacity right now and try to do as much as we can with what we have right now. So I hope this this answer kind of helps explain the gravity of the situation that we are facing right now.
Thank you. Moving on to the next question. Is the vaccination an enough tool to protect anyone else but the vaccinated individual?
So when we're talking about vaccination in general, vaccination, the process of vaccination has two main ideas behind it. First, you get the vaccine and it helps yourself, right? You get kind of some sort of immunity towards the particular pathogen that you're vaccinated towards. So that's one of the points. The second point is we are trying to have this overall immunity in a population. So even if a large majority of individual is vaccinated, yes, all those individuals are protected by that particular disease, but also the individuals that are not vaccinated are getting protected because the circulation of that virus is getting much less frequent. So from like a private health policy point of view, it's a really beneficial measure also for the people that are not vaccinated. So the if you're just looking from an epidemiological point at the benefits are for everybody. There's incontestable value towards this process. If we look at the situation right now, we are still, like, I wouldn't even say that we reached the middle of the vaccination in Romania for COVID. We're still kind of like in the earlier stages. So in the next 2 months, we will have like a much more accentuated rate of vaccination. So looking from that point of view, what we are trying to do is make sure that the individuals that are vaccinated have the right tools for themselves to combat the virus when they get into contact with it. But also another more important point of view from an epidemiological standpoint is the fact that everybody is getting a better protection against this pandemic if a small fraction of the individuals in that population are getting vaccinated. So it's a kind of two-way street when we are looking at this issue.
And maybe as a follow-up question on the vaccinations part, how do you see that people want to choose which type of vaccine they take? And also reading now all the news about some of the vaccines and some of the concerns there are. If I look at the Netherlands, they have stopped certain of the vaccines. How do you look at that? Do you feel people can choose or should choose? And what's the position you have from that point of view?
So right now, thank you very much for the question. So from right now in Romania, if you access the platform for scheduling a vaccination, you can actually see what type of vaccine do you have available. So we try to make this endeavor as transparent as possible. We want for the people to have access to all the information and have access to the right choice for themselves. Regarding the bigger picture of all the products that are on the market right now. So there's ongoing, we all know there's some ongoing investigation regarding AstraZeneca. From my point of view as an official, until further notice, we are not necessarily concerned about the safety of the AstraZeneca. There's EMA, the biggest legislator regarding pharmacovigilance policy, and until we have some sort of decisions towards this product, we can't say anything more regarding this. As a medical doctor, I encourage everybody to make their personal decision based on consulting solid scientific sources of information. We also I want to highlight there's a lot of fake news regarding vaccination. There's this whole trend of anti-vaccine going on right now. So we highly encourage people to make their own decision, but we want to make sure that they are doing that, taking into account all the correct and scientific and medicine based on facts the information regarding that toward that decision. Again, vaccination, it's free. Vaccination is voluntary medical act. So I don't think there's any pressure towards that. Everybody can choose whatever they want. We want to make sure that the message is clear. We encourage vaccination with all products.
Thank you. Coming back shortly to the IC questions, we have a follow-up. What is the total intensive care capacity of Romania?
So I think I'm not really in the position to discuss this because I'm just part of the vaccination. But from what I'm understanding, it's 1,400 intensive care beds. I think so. But this I don't really know if this concerns our topic of discussion today.
Thank you, anyhow, for your willingness to address that. Getting back to the large number of vaccination-related questions, what is the difference in the level of built immunity between a person that went through the disease and a vaccinated person? And how does the vaccination change the possibility of an individual to be a carrier versus a person that went through the disease?
Again, this is a really good question, and we're getting this question a lot also on other webinars. So the benefit of vaccination is the fact that if you get vaccinated, you're going to get a much better immune response from actually going through the disease. So from that point of view, this is really a really simple decision. You should get vaccinated. If you had COVID previously, you should wait a period of time. We recommend for you to wait a month, and after that it's also recommended to get the vaccine, because the protection from the vaccine, it's much more reliable than the protection that you are getting from going to the disease. And also if you're looking at a vaccine, the vaccine, it's more like a more general coverage regarding some of the subtypes of the COVID that we're having right now going on. So as just to have like a finishing note regarding this point, I think it's most important to get vaccinated. And if you had previously COVID, some people are thinking, oh, I had previously COVID and COVID-19 and I shouldn't get vaccinated. No, I don't think that's correct. I think everybody should get vaccinated regardless of their previously status of being infected or not with SARS-CoV-2.
Thank you. Can we expect that small children can be affected on a higher level after mass vaccination due to virus transformation?
So right now, we don't really have a lot of information regarding the pediatric community. Also, one of the factors that didn't make research for more active in this area is the fact that until recently, children weren't really that affected by COVID. Right now, if we look at studies, Pfizer, for example, had a study last week, and they discussed the fact that after vaccination, the pediatric population didn't transmit at all the virus, which is really good news. And I think this dynamic, when we are talking about the pediatric group, it's a little bit complicated because usually when we are looking at epidemic episodes of, let's just say, common flu in the pediatric area, we are looking at them being associated with going through to school or like to kindergarten or to communities. We know that that's a factor that is influencing that. And right now we're also looking at some measures when it comes to keeping some of the kids in school and keeping them in this alternate learning environment. So I think there's like a lot of moving parts regarding the pediatric population, and more development will come sooner regarding that.
Thank you. Moving on, can you provide a vaccination overview of target groups in respect of age and timing, and which vaccine will be used for which target group?
So I think when we designed the strategy for the Romanian vaccination, we take into account the target group. So as you know, we first started with the medical professionals, and that was just, let's just say in non-scientific terms, a no-brainer decision. We needed to vaccinate them because that was like the first line that we had in this world of defense. After that, we again went for the elderly population, as we discussed in the first address in the first question that you we talked about. We try to help those individuals that have like the most complicated forms of COVID-19 and we're going into what I see. And after that, we try to go in and address the principal, the most important categories of professionals, and to try to make sure that the society and the economy stays viable. And right now we're in the third part of the vaccination, when everybody can get vaccinated, and we're actually hoping that this process will get much more speeded up in the future with new large quantities of vaccine coming in the country. When we're talking about the type of vaccine, we don't really have any recommendations right now regarding the product. I think all, as I was saying in the past, I think all 4 products that we're having right now on the available for us are really good and really safe.
Thank you. A following question: when do we estimate to reach the recommended 70% of the population getting the vaccine? And when do you approximate a coming back scenario to the normal life we had before COVID-19 in the context of the vaccination?
So, as you probably know, our first Prime Minister, Mr. Kutsu, declared yesterday, I think, that we will try to come back to normality on the 1st of June. So I actually think that's quite a reasonable date. If we keep up the vaccination rate, and if we increase it by the amount of the larger quantities of vaccine that we will able to get it, I think in the summer we can actually start to see some progress in this area. And I think until the end of until the beginning of the winter, we will actually reach that 70% of individuals vaccinated. Of course, if the population is still getting vaccinated in the same rate as we're having it right now, and I think until the beginning of the winter, we can reach that point. And I think that point will be like a great victory for everybody, for the whole society, the whole world. We need to take into account the fact that this past year was one of the most complicated years in the recent history. So I think I'm trying to be skeptical, not skeptic. I'm trying actually not to jinx this prediction because we got so invested in this, and we really want for this prediction to happen.
Thank you. Now a very specific question. Can I get my vaccination in Romania if I'm a foreign citizen with a Romanian tax ID, or do I have to travel twice to my country of residence?
No. All the foreign citizens can get vaccinated in Romania.
No. I think I'm a great example of how well the system works. So I think the way it worked, the way it was supported, it went very quickly and very smoothly. So no problem with your CNP. Just go into the app, register, and then indeed wait until you get the text message that you are being called to get to the location to be vaccinated.
Thank you very much for your first-hand opinion regarding this process. And just to,
so it works.
To continue this, I think the logistical process regarding the platform and everything that's behind it is really well implemented. And I'm actually quite proud of my colleagues that were involved in this, and I think this is a really like high point for Romania when it comes to vaccination worldwide.
If you allow me, Mr. Iordache, just one question regarding foreigners getting vaccinated. We know that at least in the first and second stage, it was a rule that only foreign citizens, aside the Romanian citizens, were able to get vaccinated. Especially those ones that were coming from the essential areas. Now in the third phase, everyone can get vaccinated. I'm referring here to foreigners.
Yes. From what I know, and maybe when Mr. Andrei Baciu is gonna come to the webinar, maybe he can give you a little bit more information. He's more documented in this regard, but from my knowledge, I think everybody can get vaccinated, so there's no issue. We, as a general policy of the Romanian campaign of vaccination, we're trying to get everybody that wants to be vaccinated. If they have like the legal right of getting vaccinated, we are going to vaccinate them.
Thank you very much. The question came out from various discussions that we had with our members, and I can give you a small example. People that are working in the drug distribution, I'm referring to medicines, oil and gas and so on. So the people that were working in the company were able to get vaccinated, while their families were not able to get vaccinated in that stage. So,
yes, because that was the particularity of the logistic and the methodological aspects of that stage of the vaccination. But right now, everybody it's eligible to get vaccinated.
Okay, thank you very much.
You're welcome.
Moving on to a technical question, is it necessary to have 2 doses of vaccine if you already had COVID? And if no, can the second dose affect you in some way?
So we always recommend people to get both doses. So regardless of the previous status of being positive or not with COVID, it's important to get both doses of vaccine. And this comes from medical perspective, because we want to make sure that the product was created for general use with two doses. So we want to make sure that we respect those indication, and based on respecting those indications, you as an individual can get the best immune response for vaccinating yourself. And also from a logistical point of view, I think it's quite complicated if you don't get the second dose, because when you get in the platform and you book a spot for yourself for getting vaccinated, and you get the first dose, the second dose is put on freeze, let's just say, and based on that, you can have the same batch of vaccine for the second dose. So that's we're also going to create some logistical issues in our end.
Speaking of logistics, there was an understanding that from the 1st of April, you could see the estimated waiting time on the Vaccinare platform. When will this function be added to the platform?
So I think this function will be added in the next couple of days, hopefully. I don't have right now a clear timeline regarding that, but I know that my colleagues are working on this and they are trying to fix this issue as fast as we can. So probably a week.
Thank you. When vaccinated, is traveling unrestricted?
So I think this is a two-part question. When we're talking about traveling, we are talking about internal traveling or international traveling. I think if we are talking about Internal traveling, things are more simple. Even if there will be some sort of like a restrictive measure, you have that particular certificate of vaccination, and that kind of provides you with all the information needed for the authorities to just confirm that you've been vaccinated. When we're talking about traveling abroad, that document is only for use, the certificate of vaccination is only for use in Romania. We are looking at right now at some changes in that, let's just call it green card for vaccination or for like traveling, which includes being vaccinated, have a negative test, or having been passed through a COVID infection in the recent period of time. So when we're talking about traveling abroad, I think we need to look at what's going to happen with on a European level with this green card for traveling. So we, as a country, we support the integration of this green card in Romania, but I think there's like a lot of issues that need to be addressed before we can have that implemented as a European level.
Thank you.
But just to clarify something, if you are vaccinated in Romania, you have that particular certificate, and that certificate is going to be valid for obtaining the green card. So from that point of view, from the logistical point of view and legislative point of view, there's no worry regarding that.
Mm-hmm.
Thank you.
And you were referring to the 70% of immunity or vaccinated people to get to the end line, or at least the moment that things will change again, the victory that you were referring to. Do you see that the willingness to vaccinate and the speed of vaccination is equal across the country? Or do you see, for instance, a big difference between cities and the areas outside the cities? And is there something where attention is needed?
So you're right in your presumption. So we're seeing a much more proactive attitude in the big cities, and as we look into the rural areas, there's some issues regarding the vaccination. But I think right now we are trying to push this message through all the channels possible. So recently, and also in the past, we had discussion with all the religious cults in Romania, trying to push this message towards the people in the rural areas. And we're also trying to involve the local municipalities towards informing the population in these rural areas to get vaccinated. I think it's as a communication process, there are always going to be some difficult points, some bottlenecks in this process, but I think right now we're doing quite well in this regard, and we are trying to prepare and predict communication strategies for these issues as we speak.
Thank you. How contagious is the new strain discovered in the UK compared to the first strain of COVID-19? And are the vaccines effective against these strains discovered in the UK?
Again, this is a really good question, and we have tried to address it a couple of times in the past. So this new strain of COVID discovered in UK, it's more contagious. It brings us to a new challenge when we're looking at like how can we defeat this pandemic. The good news is the vaccine seems to be working at least in part against this new strain of COVID. As we are talking, there's multiple studies trying to understand what are the genetic particularities of all the new variants of COVID that are showing up all around the world, and how can we contain and how can we provide a vaccine that's good, that's efficient for all those types of strains. But just to answer the question, yes, it's more contagious than what we see previously. And right now, it seems to be all the vaccines seems to be working in a certain percent against that.
Thank you. Do you consider that new protection measures are required compared to the old ones we already respect, such as protection masks, social distancing, hand and surface disinfection?
Well, again, I'm gonna just respond to this question from my position as an epidemiologist, not necessarily as a member of the vaccination committee. I think the government and the officials are trying to push the best measures right now for combating this pandemic. I don't really know if new restrictive measurements or protection measurements are needed right now. I think it's more about setting up better processes, better epidemiological processes for like looking at how people are circulating in like, let's just say, in a city or in an institution, or for like making sure that we embrace all the new technology when it comes to hygienization, sterilization, and stuff like that, and try to implement those things. I don't think that restricting something is necessarily good. I think it's more a race toward embracing better solutions that are using the measures that we have right now and try to make the best out of it. As a scientist, I'm always trying to look at creative solutions for different issues, and not to say, okay, restricting something. I don't think that restricting something in general can improve the outcome of a solution. Of course, I'm 100% agreeing with the protection measurements that are required right now, and I fully support them. But as future steps, let's just say the vaccination is one of the creative way of combating this this pandemic, and it's reflecting like my paradigm of thought, like creating something that can improve the outcome of a crisis, and like doing something proactive towards fixing that issue.
Thank you. Can a person who has been vaccinated against COVID-19 with Pfizer, Moderna, or AstraZeneca still get the disease, and can it still pass on the virus?
Okay, so I think again here are two answers. There's a purely scientific and statistical answer, and that answer is yes, it's still possible. The statistical chances are really slim. So we are talking about like 1% of less than 1% probably. Also, if you get vaccinated and after that you get in contact with somebody that has COVID and you develop a form of COVID, let's just say that that form of that clinical presentation of the disease is much more mild. It's much easier for the organism. And you can also transmit the virus, because the virus can stay at like the level of the mouth and nose, and can just stay there, and when you talk you can still disseminate it. So that's why we still advocate for wearing a mask, and I think wearing a mask is going to be the last restrictive measure that we are going to get rid of. And I know some of the people don't like the masks, but from a epidemiological point of view, I think the masks are really important right now. And I know there's an inconvenience, but I think they're really good in helping the pandemic.
How long will vaccination keep us immune?
So again, we don't have a full, like we don't have certainties, scientific certainties regarding this, but it's expected to be around a year. So what we'll probably see is something similar to the common flu, to the influenza. We are going to see overlapping of immunity for 1 year, and after that, depending on the epidemiological situation, all the population can get vaccinated again, or some small categories can be vaccinated again, or we can do like some sort of testing and see what are like the antigen levels, and after that, only a small part of the population, but it's expected to be around 1 year.
All right, thank you. How can companies organize their mobile vaccination center?
Here, I think also Andrei was, if Andrei will be able to join us, can give you a better insight. But I can give you some basic principles regarding how a mobile vaccination center can be made. So just starting from like the really simple paradigm of vaccination, what we try to achieve. We try to achieve accessibility of the vaccine towards individuals. If we can provide a mobile medical center, like a mobile platform for getting people vaccinated, for us is a plus. We are probably gonna let each company decide the particularities of that center. Of course, it needs to have some standards regarding access fluxes and storage and stuff like that. So there's some particularities that still need to be taken into account. But usually most of the companies, of the large companies, I guess, have some sort of space that can be used for working as a vaccination center. Again, the logistics of this process are still being developed, but what I can assure you is we are trying to push this initiative as quick as we can, because I think it's actually easier for individuals that are working in one environment to get vaccinated at their workplace. I think it's actually better, and it's also beneficial because from an epidemiological point of view, just having to travel to a vaccination spot and getting back and like getting into contact with the people that are there can present a risk. And if you work with somebody in a work environment, you kind of get into contact. You kind of get into contact with those individuals regardless. So if you can get the vaccine, it's less of a risk regarding getting COVID. So I think it's better it's a really good initiative from all point of view, and we will follow up with more information regarding that.
Thank you. The next question was actually a continuation of this one. If we can use mobile vaccination teams in an on-site office.
Yes, I think I don't want to say 100% yes, because there's still some working moving parts regarding this decision. But I think this having like a mobile vaccination team in an on-site office, it's the way to go.
Mm-hmm. And in light also with the mobile vaccinations, I also noticed quite a lot of pro-vaccination campaigns by either private companies or associations. And I was wondering, you touched upon the importance in the beginning of disseminating the right information, making sure fake news is not getting a hold. How do you view the private campaigns for vaccination? And what kind of collaboration would you prefer as the Ministry of Health in those type of campaigns? Because maybe that can also help our members think about, if they want to start such a thing, how they can best approach it.
So first, just to address start addressing this issue, we want to thank all the companies that were getting involved in promoting this message of pro-vaccination. And I think it's the communication process for us was an ongoing process. We always trying to identify issues and fix them, and we are going to identify more issues and fix them again. So if we're talking about private companies, I think with this third step of vaccination, when everybody it's getting vaccination, the stakes are much higher. The number of individuals that needs to get vaccinated is much higher. And just as a statistician, if the margin of individuals is higher, the number of people that are not getting vaccinated because of like some misinformation or some fake news, like their decision being affected by one of those situation can impact a lot of like that 1%, let's just say, of individuals are not getting vaccinated because, I don't know, they heard a fake news. That 1%, when we're talking about the whole Romanian population, it's like a really, really large number compared to 1% of the medical community that probably would go through the same process. So I think right now the stakes when it comes to communicating on all levels, and especially on like a professional, like a work environment level, I think it's really, really, really high, the level of importance. And one thing that I need to address here is, I think if people are getting the right messages in this professional environment, in this work environment, I think they can be better received than if they get them from, like, I don't know, some like general information site or like some general information campaign. Because as a professional, as an individual who worked previously in research or like in research companies, I think getting something from your colleagues or like from your supervisor has a bigger impact on a human level, on a sociological level. Again, I'm not a sociologist, but I think it's really, really important to personalize the message. The message is available there, but the way of making sure that people are embracing that message or are receptive to it, I think it's the most complicated part right now. And I think here private companies can really, really have a big impact in making sure that the message of getting vaccinated, it's well received and it's correct received. And also, it's not also about getting vaccinated. It's also about like the news that are circulating right now regarding, like, I don't know, like AstraZeneca or like something that's going on. I think people can pick up information from different spots, but and we as official, we try to provide the right picture, the correct picture based on scientific documents. But also, I think if those information are coming in a more natural way from the work environment, I think that's can actually increase a lot the capacity of the success of the vaccination. So we're still trying to develop methods of like getting companies and getting you guys involved in this. And again, we really, really want to thank everybody for the support that you gave us.
Thank you so much.
Thank you. No, I think I just saw State Secretary Baciu joining the call. So State Secretary Baciu, welcome very much to the call. I think we had the honor to learn a lot and to get a lot of information from Dr. Paul Jurdache. But given the fact that you're now in, I would also like to hand over the floor to you. And you might want to introduce yourself and maybe share some of the key messages you had for us.
Thank you so much. Bonjour à tous. Sorry, extremely sorry. I'm extremely sorry for this delay. It's something that I deeply hate, to overlap things after the press conference that we have each Tuesday. I was held here at the government premises for a specific action, but once again, I'm really sorry about it, and I'm just got out of a meeting so I can attend. Hopefully my colleague Paul managed to answer some of the questions that you might have, and I can imagine a couple of the questions that you were thinking about and the specific specific question actually for the private environment. So here I would like to jump into a couple of ideas that might be of interest to you, and then I'm open for a couple of questions. So one of the most important things that I've been hearing a lot in the past couple of weeks is the opportunity of having vaccination spots within the private entities. So this is a thing that we are working on, and we've been discussing this as well with the Prime Minister, the opportunity for the private companies to develop vaccination spots within their company for their employees. And as well, we have a couple of requests as well from some companies that wish to offer as well that specific vaccination site for the general population. We will come with updates in the following days regarding this opportunity. Of course, it comes with important advantages. The fact that you are able to provide the direct access for all the employees who want to get vaccinated to the vaccination process. This can be achieved immediately. This will also guarantee you a certain immunization, or a certain percentage that will guarantee you further on, basically, a continuity within the working frame, and most likely avoid any epidemiological hotspots that occur in any community where people gather. These things occur. So this is one of the most important things. We will come up with important communication in the following days, also next week. Hopefully we are able to launch it as soon as possible. It's something that will help the economic activities a lot. Then as well, in the meantime, actually, everybody who wants to get vaccinated, so please do not hesitate to subscribe on a waiting list. You just, everything that you need to do today is to sign up on the vaccination platform that you already know, and then just pick a vaccination center and just register on the waiting list, and then the platform will let you know when you have been allocated to a vaccination time frame, and then the only thing left to do is to select the hour and the day when you can be present at the vaccination center that you already chosen. So this is one of the main ideas for which I thought that such a discussion might be interesting. We will let you know the details of this specific of the procedures for the vaccination site within the companies, but it's something that for which we have received a lot of questions, and I thought that this might be a great opportunity to hear it officially, and to for those of you who want to think about something like this, to have all the information you need. So other than that, I'm open for any question. I'm sorry once again for the delay. Hopefully Paul will manage to provide you with all the answers.
Thank you so much, State Secretary. Yes, indeed, we have enjoyed the help of Dr. Iordache, but we still have a couple of questions. So I will go to the first one. Romania's vaccination strategy against COVID-19 includes the development of the legal framework for establishing a mechanism of compensation for any possible long-term effects connected to vaccination. What is the stage of discussion at the Ministry of Health regarding a potential no-fault compensation system for COVID-19, and when can we expect a draft normative act to be put up for public debate?
Indeed, there's a mechanism that has been initiated at the European and the global level, actually. So there are a couple of countries that have already something like this in place for general medicine. But there is something that at the technical level, the discussion and the analysis have been started for quite a time already. And the idea is to align our mechanisms, the mechanisms developed at the European level. So I think that in the near future we will going to have. I mean, there were several ideas in place. Not too many countries had already something similar, and they wanted to upgrade it to reach I don't know, a European standard, let's say. So I think in the near future we are going to have updates on this matter as well. But it's a thing of, I mean, the discussions are at the technical level now, and also considering the discussion at the European level, because it's a thing that is considered in several countries, in most of the countries at the European level.
Thank you. Coming back a little bit to the issue of on-site vaccination centers, what is the minimum number of employees in order to open such a vaccination center at the working site? And is it possible for companies to get material from the pro-vaccination campaign?
So two different aspects. We didn't decided yet on such a criteria, but the main idea of opening a vaccination center is to basically to increase the access towards the vaccination facilities, toward the vaccination process itself. So of course, given the fact that we still have a limited number of doses, we have to find a way to prioritize this limited number of doses that we still have, but we will come up with a final point on this matter, and we will communicate in the next couple of days, latest next week, regarding this aspect. Then regarding the communication process, of course, anybody who's interested in joining our efforts of communication, we will increase our communication efforts in the next couple of days and weeks. And but for the time being, anybody who's willing to support us in our communication activities, we have important materials already that we already used, and we are more than open to transmit any materials that we already have, video, and several types of flyers, infographics, and so on and so forth. So basically, we're open to transmit it to anybody who's interested in using it. Feel free to write us, and we will get back to you with anything that you might need.
Thank you. A following question on the no-fault compensation mechanism. Currently, there are around 16 European countries, out of which 11 are EU member states, in which the no-fault compensation system has been implemented for vaccination in general. Is Romania taking into consideration the good practice models proposed by other states in order to advance its own no-fault compensation mechanism? And if so, which are the country models that the ministry is considering, and which type of administration and funding models is the ministry considering appropriate for Romania based on preliminary assessments? It's a long question, but...
Indeed, so from the early beginning, we knew that there were around 11 countries that already had such a mechanism in place. We have to know that this is a mechanism that was already used for other types of medical procedures, especially related to use of certain molecules. So it was something that it was already in place, and it was only also feasible for the vaccination process itself. So from what I know, in the past couple of weeks, there are no countries, no additional countries that managed to finalize such a mechanisms. But this is also something that we've been looking at, and hopefully we'll manage to come up with updates as soon as possible on this matter.
Thank you. And because we are all looking forward to the era post-COVID, are there any green measures planned by the Romanian authorities in the post-COVID-19 health design strategies? More specifically, studies show that the therapeutic landscapes impact on the recovery process of patients. Are there any healing garden concepts including in the plan rehabilitation projects or considered for new hospital projects? That's a hopeful question. We're looking forward to the future.
Well, everybody is. So it's indeed a very new chapter, unexpected one. So everybody's looking forward the end of the pandemic and then the start of the post-pandemic life and world. So of course there are a lot of projects, opportunities, especially given the European funding opportunities, which are considered a game changer for our society. financial opportunities without precedent. So that gives us the opportunity to think big, to think of lots of dimension where we can try at least to change the paradigm that still exists unfortunately today in Romania, and move it towards a prevention paradigm, also from a hospital point of view, let's say. In addition to the financial opportunities that we also have the continuity opportunity. So basically, we didn't have the opportunity to implement the measurements and the strategies and the plans that we've been developing in the past couple of years, because of the fact that usually, well, the Ministry of Health, for instance, had way too many ministries in the past 30 years. So this thing, I mean, given the fact that if you change the leadership way too early, at the end of the day, you won't be able to reach your objective. So this is a very important sine qua non opportunity from my point of view, because of the fact that this government, this coalition, has only started now, and it's able to design strategies for the next 4 years, which is crucial for the change of paradigm that we aim to do in the healthcare sector. So from this point of view, of course, combining these two opportunities, the financial and this 4-year time frame opportunity, I think it's crucial and for our healthcare system. And of course, we will look into several dimensions of actions. Of course, hospitals are the one of the most important pillars of any healthcare system, but not only as infrastructure and human resources and equipment, but also I think it's extremely important to have an integrated approach. This is the only way to change and to dare to change, to have a systematic change of any wider system or healthcare system, if it's today's topic. But it's important to have an integrated approach. So from this point of view, the European the PNRR, the European relaunch program, is something that will, I think, be the engine behind all the change that we're expecting within the healthcare system. So we have to look specific for each sector that we're interested in, but I mean, we are more than open to have discussion for each sector that it might be a concern.
Thank you so much for all your answers. Serge, I think you wanted to add something?
No, I think the looking at what we have discussed, I think we have touched upon many topics, and we also in the prior discussion with Dr. Jordache, we had a bit of a discussion about cities versus the rural areas. I was also still wondering, do we need to, or can we somehow give the attention to also some people which are more vulnerable and maybe disadvantaged? And what kind of steps are we taking to make sure that everybody is getting the vaccination and is protected going forward? And is there also maybe something we can do to give awareness to that, or to support the accessibility to the vaccination program for those type of categories?
It's indeed, I think, the crucial point of the vaccination campaign for any countries to get the people at risk vaccinated first. So it's something that we still, and we will have as a priority until the end of our vaccination campaign, meaning that anybody who's a part of the second stage, so everybody who's over 65 years old or anybody who has any chronic disease are going to be considered a priority within the waiting list. So anybody who's on the second stage, eligible for the second phase, actually, regardless of the moment of the registration on a waiting list, they will be moved towards the front of the waiting list immediately, and they will be scheduled for vaccination with priority. So this is a thing, as a general principle, that we will keep until the end of the vaccination campaign. Secondly, regarding the spreading the message, I think it's extremely important to spread the news that now the third phase of the vaccination campaign is open. So anybody who is willing to get vaccinated, there's only one single step that everybody needs to do: to get on the vaccination platform, create an account, and then just pick a vaccination center and just register on a waiting list. This is the only thing that you have to do. You don't have to look for opening of new vaccination centers or just to wait and see if there are new doses coming or not. Just create an account, select the vaccination center, register on the waiting list. The system will do the rest. It will contact you once you've been allocated for the vaccination, and you just need to enter and select a day and the time frame where you will be present for the vaccination itself. What you can do and what everybody can do is to promote this message. We have, I mean, the vaccination is quite simple. I will pronounce it in Romania: vaccinare-covid.gov.ro. It's quite intuitive, but other than that, for people who have difficulties in accessing this vaccination platform, we have a phone number. We have their colleagues who speak also English and other languages, so it's quite an easy number to remember as well. 021 414 4425. It's we have over 600 colleagues that pick up the phone, so they have over 1,500 phone lines through which you can call, so they will register immediately anybody who calls. So we have these two important communication line. Please do not hesitate, and this is the most important thing that anybody can do now. Spread the message. Get on the vaccination website and just register on a vaccination center, on a waiting list. This is the only thing that you need to do right now.
Thank you very much. I think with this last question, I think we have touched upon all the questions of our members and of ourselves. So thank you very much, State Secretary Baciu, and thank you very much, Dr. Iordache, for spending this hour with us and actually addressing all the questions and sharing this very powerful message. If I would need to summarize this hour for the members listening, and we will also share this with our broader community for those who were not able to attend. I think the key thing for me that stands out is the sharing of the message, and also making sure that people have the right information, that there is not fake information, and also to reiterate the importance, but still that it's their own choice. I think the right for people to choose is very important. I will only reiterate what I said in the beginning. I think with the vaccination, the app being open, people being able to register, everybody is there. We had some questions. Is it possible for foreigners? Now, I'm the living proof that it's able for a foreigner to be vaccinated in Romania. And I think I think the speed and the pace with this goes, and the simpleness and intuitiveness of the program, I think it just complements for the way it's done. And I hope everybody will also take this opportunity. And I think first and foremost, we also have as companies a responsibility. And we will also look forward to getting the further information when it comes to the mobile vaccination centers and some of the pro-vaccination campaigns. We will share it with our members, but we will also look forward as a chamber to see what we can actually proactively communicate. And this is what in the beginning of the webinar I also offered to Dr. Iordache. If there's anything you believe where we can play a role as an actor in the Romanian society, yeah, we are ready to be a constructive partner, and we will see in what way we can help you, because we do believe that getting the awareness and making sure people understand how to get vaccinated and getting to that level of vaccination of 70%, that the country is actually safe, and to getting to that target towards the winter, everything we can do to help there, we are ready to help and support you and the rest of the team. I'm not sure if you have any final words you would like to share with the people to close the webinar, but I would give the floor to you as a final closing remark.
Thank you so much once again for this great opportunity. I'm extremely sorry for the delay. It's something that I deeply hate, but unfortunately it happens. So we are open even from now on to any kind of support, any kind of collaboration that you think it might help increasing the and speeding up the vaccination campaign. Thank you so much, everybody, for your involvement so far, because I know that some of you have been actively involved in spreading the message, in supporting the vaccination campaign. So I think that only together we can achieve this greater goal of reaching the 70% collective immunity, where we basically neutralize the community transmission of the virus. So basically we won't be needing the measurements that we have today in place, and hopefully you will manage to do the same thing as wider as possible at the global scale. At the European level, I'm certain that we will manage to reach it together, but further than that, please count on our support, and we are open for any kind of collaboration towards speeding up and expanding the vaccination process. For any of you who are interested in opening a vaccination spot within a private entity, please do not hesitate to reach out. We are going to finalize our mechanisms in the next couple of days, and we will communicate regarding this matter, which will speed up even more the vaccination process, also for the private entities which we consider as a top priority because of the importance of the economic dimension, additional to the social and medical crisis that we're facing today. So thank you once again for your time. Sorry for the delay, and looking forward to being able of having such a meeting as we used to have it without a mask and physically. So we only can achieve that by vaccination. So thank you so much once again, and looking forward in achieving this 70% rate as soon as possible.
Great, thank you very much, and we will hopefully see each other soon in person. Have a nice day.
Thank you so much.
Cheers. Bye-bye.
Thank you so much. Have a great day. Thank you.
So with this, I believe we reached the end of our webinar this evening. Thanking you all for taking the time to log in and be with us tonight, and of course thanking our esteemed guests, State Secretary Baciu and Dr. Paul Iordache. We are looking forward to seeing you back with us for our next event, still online. It will be a quiz royale on the 27th of April, related to the King's Day of the Netherlands. Until then, take care everybody, stay healthy, get vaccinated, and have a great evening.
Bye.
Bye-bye.
Thank you. Goodbye.
Thank you. Bye bye.